Module 1. An Introduction to Child Intervention in Alberta. Module 1. Learning Objective. Describe the Child Intervention Delivery Division. Module 1. Ministry of Children's Services. The Ministry of Children's Services is a part of the Alberta government and provides a range of services including early intervention and prevention, child care, early childhood development, child intervention delivery, services to children in care and at home, post-intervention supports, and adoption. We respond to reports concerning the safety and well-being of children and youth in Alberta. We offer a range of supports and resources for children and youth and their families and kin in 5 regions across the province. This includes Calgary, Central, Edmonton, North and South regions. Culturally specific services are also provided through Metis and Indigenous Children's Services offices and delegated First Nation agencies. Module 1. Provincial Outcomes. Children's Services is focused on achieving 5 provincial outcomes for children, youth, and families. Children's Services aims to ensure children and youth are safe at home and other places in the community. Children in temporary care will be reunited quickly with their families. Children in permanent care will be placed in permanent homes as quickly as possible. That children and youth in care live in culturally relevant placements whenever possible, and the use of innovative approaches to help Alberta's vulnerable young people become contributing members in their communities. Module 1. What is child intervention? Child intervention delivery is a division within Children's Services, and our focus is on creating safety, well-being, and connection for children by demonstrating competence and an anti-oppressive approach in the following 4 domains of child intervention practice: child safety, permanency, child well-being, family and community support. We are sometimes also referred to as child intervention services, or child welfare, or child protective services. Child intervention delivery focuses on the safety and well-being of children, supporting families to be healthy, and ensuring children grow up in safe and nurturing homes. The day-to-day work of child intervention is carried out by child intervention practitioners and is informed and directed by the Child, Youth, and Family Enhancement Act and the Child Intervention Practice Framework. Module 1. Who do we serve? Child intervention delivery provides services to children, youth, and families who are or may be at risk of being abused, neglected, or otherwise in need of intervention. The threshold for services under the Child, Youth, and Family Enhancement Act must be met in order for a family to receive services. On average, Children's Services provides child intervention services to 1.7% of the population of Alberta's children. Module 1. Service Delivery Structure. Service Delivery Regions, Ministry Staff. 5 regions across the province. 85% of children receive services through a region. Staff are delegated to make case management decisions. Delegated First Nations Agencies, or DFNAs. 17 DFNAs in 3 treaty areas. Agreements with 37 out of 48 First Nations. DFNA caseworkers are delegated to make case management decisions, but are not Government of Alberta employees. Module 1. Regional Responsibilities. To meet the needs of First Nation children and youth living on reserve, Children's Services recognizes and values the necessity for First Nation communities to have a role in the design, implementation, and evaluation of child intervention services. Provision of services under SIFIA to 37 of 48 First Nations in Alberta occurs through bilateral and trilateral agreements with 17 DFNAs. Through these agreements, each DFNA is accountable and responsible for ensuring that children in need of intervention on the member First Nation reserves receive the services they require. DFNAs are accountable and responsible to Indigenous Services Canada for the funding they receive from the federal government to deliver these services. Module 1. Band Designate. Band Designate. As per Section 107 Sub 1 of the SIFIA, the Band Designate is the primary contact person for the First Nation and the DFNA. The organizational structure and cultural protocol of each First Nation is unique and independent. As a representative of Chief and Council, the Band Designate receives their individual authority by their Band Council. This is important to consider when seeking consultation from the Designate. Module 1. Metis Resources. Metis Resource. The Metis Nation of Alberta, or MNA, is committed to supporting Children's Services regions to ensure that a Metis resource person is made available to Metis children and their relational connections when requested who are not affiliated with the Metis settlements. The Metis resource person is the primary MNA contact person for the DFNAs regarding case planning for Metis children and their relational connections. The Metis resource person assists Children's Services staff in planning and the development of cultural plans to ensure a comprehensive approach to wellness is undertaken. The Metis resource also ensures connection to other care service agencies and social support agencies to ensure children receive access to appropriate and relevant services in a timely manner. Module 1. Who delivers services? Children's Services employs nearly 2,900 staff. Over 2,500 staff provide services to clients in child intervention regions. This includes frontline direct delivery staff, supervisors, support staff, and managers. In the 17 delegated First Nations agencies, there are over 400 child intervention staff, including directors and administration. 4,000 full-time equivalents in contracted agencies. Module 1. Staff Composition. Our child intervention practitioners have various working titles: intake worker, assessor, caseworker, generalist, casework supervisors and managers, foster care, kinship caseworkers, adoption caseworkers. Includes staff who are social workers, but also other diverse educational backgrounds. Social worker is a protected term under Health Professions Act. Training for new caseworkers is specific to child intervention practitioner training, or delegation training, and happens over several months. Module 1. Providing support. Child intervention has two main functions. Number 1. If a child does not need intervention, but the child's parents or guardians are facing challenges, child intervention can refer them to other services and/or supports in or near their community. What are 3 reasons why this information is important for you to understand? Module 1. Intervention is required. Number 2. If a child needs intervention, we work with the family, extended family, community partners, and other supports. We help parents identify what they're doing that is helping their child and also what they need to improve so their children will be safe. What are 3 reasons why this information is important for you to understand? Module 1. 3 reasons this is important. Child intervention helps parents and guardians identify what they are doing that is helping their child and what they need to improve so their child will be safe. Provides services and connects children and their families to agencies that will provide supports like counseling or parenting help. Every effort is made to support the child's connections and allow the child to remain safely at home. Module 1. Who we work with. Child intervention works with the parents and guardians, the child, and families work with their family support network to identify a caregiver who can care for the child, kinship care. After every attempt has been made and no connections are able, a foster caregiver is asked to provide them with a safe home. Module 1. Test yourself. True or false? The day-to-day practices of child intervention are guided by Alberta Health Services. Sorry, the correct answer is false. The day-to-day practices of child intervention services are guided by the Child, Youth, and Family Enhancement Act, CYFIA. You're correct. The day-to-day practices of child intervention services are guided by the Child, Youth, and Family Enhancement Act, CYFIA. Module 1. A child intervention. If the child's caregiver cannot maintain safety while the child remains in the home, the child may need to temporarily or permanently leave the home. When a child must leave their home, child intervention works with the child's parents and guardians to create a plan that provides the child with stability, continuing care, ongoing connections, and respect for their heritage, culture, and religion. Module 1. Test yourself. True or false? When a child is brought into care, the goal is to work with the child and their parents and guardians to create safety within the family and stabilize the home so they can return to their parents and guardians. True. When a child is brought into care, the goal is to work with the child and their parents and guardians to create safety within the family and stabilize the home so they can return to their parents and guardians. Module 1. An Introduction to Child Intervention in Alberta. Congratulations! You've completed Module 1. Next, Module 2. Child, Youth, and Family Enhancement Act, CYFIA.